All right, so now that we have touched on our background of safety, we are going to get started into the initial principles of infection control. First thing we want to understand is what is a microorganism or a microbe. These are going to be our smallest living organisms that are not visible to the naked eye, so we're going to need a microscope to be able to see or view them. But they're found everywhere in the environment. These can be part of our normal body flora, which we know as non-pathogens. They are not harmful and tend to be beneficial to certain body processes depending on where they're located. If they are harmful, we might see them start to cause infections and disease. That's when they're known as those pathogens or germs. And depending on the microorganism, we may see that it's beneficial in one system and harmful in another. So, for example, there is a form of E. coli that lives naturally in our large intestine, but if that same form of E. coli got into our urinary system, it's going to result in an infection. So, how do these microorganisms grow? They have to have a specific environment to be able to grow and reproduce. It needs to be warm. Unfortunately, human body temperature is the absolute perfect condition and warmth for them to grow and reproduce. Ideally, they're going to be somewhere dark. A lot of times you see them killed by sunlight. They need a source of food and moisture. Again, inside the body is going to be a perfect setup for them. And then their oxygen needs are going to vary. If they require oxygen to live, we'll see them referred to as aerobic. If they're able to live and reproduce without oxygen, we'll refer to them as anaerobic. An is our prefix that means without, so without oxygen. We're going to talk about these different classifications of microorganisms. We're going to look at bacteria, protozoa, fungi, rickettsia, and viruses. So bacteria are going to be our simple one-celled organisms. They multiply relatively rapidly. When we talk about how they're classified, it's going to be based on their shape and arrangement. Our first shape is going to be cocci, which are round or spherical, and they can occur as diplococci, which are pairs or two circles. These types of bacteria are going to cause things like gonorrhea, meningitis, or pneumonia. Our streptococci occur in chains, and this is going to cause something like strep throat or necrotizing fasciitis, which is flesh-eating bacteria. And then staphylococci is going to occur in clusters or groups. These are going to be our most common pus-producing microorganism. So these are going to be the ones that you see cause things like boils, urinary tract infections, wound infections. So if you scrape your knee and it gets infected and starts to have that pus drainage, that's going to be a staph bacteria. Now, I would make sure that you remember these different types of cocci, or at least the different ways that they occur. You might see that again on a test. When we're looking at our shapes, again, where you have bacilli, which are rod-shaped, we can see these either singles, in pairs, in chains. They might have a flagella or a projection that's similar to a tail that helps them move. These are going to have the ability to form spores or a thick capsule around their outside. When conditions are poor, they don't really have the ability to grow and reproduce like they would normally. So they put that spore, or think of like that chocolate shell that you can put on ice cream. It gets on there, it gets really hard. You have to work harder to break through it. And it makes them harder to kill when they're in this spore form. We'll see these bacilli cause things like tuberculosis, tetanus, pertussis or whooping cough, botulism, diphtheria, and typhoid. And then our last shape is going to be spirilla or spiral or corkscrew shaped bacteria, which is going to cause diseases like syphilis and cholera. So how do we treat these bacteria? Antibiotics is going to be our primary treatment, but we are seeing nowadays that a lot of times when doctors don't know what something is, or they just want to help a patient feel better, they'll just throw antibiotics at any sickness to try to get rid of it. That overuse of antibiotics has led to certain strains that are now antibiotic resistant. So the antibiotics don't work against them, they don't kill them. And these are what we know as superbugs or multi-resistant or multi-drug resistant bacteria. So they're resistant to several different drugs, which are things like MRSA, VRE, MRAB, and CRE. I would make sure you know that those are some of our superbugs. When they get to this antibiotic resistant state, they're much more difficult to treat. A lot of times they'll require extremely high powered antibiotics that can only be given through an IV, which leads to an increase or longer hospital stay and an increased cost in the healthcare, which affects everyone because once our cost of healthcare goes up, we see that change our cost of insurance or cost of doctor's visits. It doesn't just pertain to that one person who has the infection. Next, we have our protozoa. So these are our one-celled animal-like organisms. We're going to see these in places like decayed materials, animal or bird feces, insect bites, contaminated water. A lot of times these protozoa will have those flagella or those tail-like structures to help them move around. Like anything else, some of them are going to be pathogenic, so they're going to be causing different germs or diseases. And they can cause things like malaria, amoebic dysentery, trichomonas, and African sleeping sickness. Our fungi are going to be our simple plant-like organisms. They live on dead organic matter. And fungi is a broad term. It's not always going to be something pathogenic. So yeast and mold, those can be pathogenic or non-pathogenic. Mushrooms, a fungi. Some of them are healthy and good to eat. Some of them can be poisonous or dangerous. We're going to see fungi cause diseases like ringworm, athlete's foot, histoplasmosis, yeast vaginitis, and thrush. Fungi are going to be treated differently. They're going to require an antifungal medication. They're not killed by antibiotics. This usually is going to be an oral medication, or for things like athlete's foot or ringworm, it might be a cream that goes on the area to help it heal. Rickettsia are going to be some of our parasitic microorganisms. As a parasite, they cannot live outside the cells of another living organism, so they can't survive by themselves. We might see them located on fleas, lice, ticks, mites. They tend to be transmitted to humans by the bites of those little insects that they live on. These are going to cause things like typhus fever and Rocky Mountain spotted fever. Thankfully, they are cured with antibiotics, but again, it's something we have to watch out for, especially in areas that may not have specific hygiene standards, or that we see a more rampant infection of things like fleas and ticks. Viruses are going to be our smallest microorganism. They are not able to reproduce unless they're inside of something else that's living. We tend to see these spread by blood and body secretions. They are very, very difficult to kill. They tend to be resistant to a lot of disinfectants, and they're not affected by antibiotics. You need an antiviral medication to kill a virus. Things like the common cold, measles, mumps, chickenpox, herpes, warts, influenza or the flu, and polio are all different types of viruses. And one thing we need to consider when we talk about viruses is that they change and mutate very, very easily. So when we look at things like the flu vaccine, people tend to complain that they got the vaccine, but they still got the flu, which is true. Every year they make a new flu vaccine that's supposed to be resistant to what's expected to be the most common strains of flu for that season. There is no way, unfortunately, that we could protect against every type of flu virus. So we also see that some of these viruses that infect animals have mutated to now infect humans. Examples of some of those are things like SARS, West Nile virus, monkeypox, which we are now seeing an unfortunate increase in. It's a hantavirus that we first saw in monkeys, rodents, and other primates and has now mutated to spread to humans. Ebola, we also first saw in primates, then spread to humans. And then H5N1, or the bird or avian flu, an H1N1 or the swine flu, I would make sure that you're at least able to identify the difference between which of those is avian and which of those is swine, as well as which of these diseases is a hantavirus. When we're talking about viruses in healthcare, just like we mentioned in our safety unit, there are going to be three main viruses that are a big concern. Hepatitis B affects the liver. If you contract it, it can lead to destruction and scarring of your liver cells. There is a vaccine available. It's a 3-shot series, and it has to be offered to you at no cost if you work in healthcare. If you choose not to get it for any reason, even if that reason is that you've already had it before, your employer has to have a written record of your refusal. Hepatitis C may be asymptomatic, which means we don't have symptoms, or they're mild, similar to the flu, which means it's harder to diagnose. It can cause very serious liver damage, and there unfortunately is no vaccine as of right now. The last is the human immunodeficiency virus, or HIV. Eventually, HIV will cause AIDS, which both of these suppress our immune system. There's no cure, no vaccine, and eventually will lead to death. There is some pretty excellent antiretroviral treatment that is now out and helps suppress the HIV virus so people are able to stay healthy for longer, but eventually it will turn into AIDS and as a result usually lead to some other opportunistic infection that will cause death. So the next thing we're going to talk about is helminths. These are multicellular parasitic organisms that we usually see referred to as worms or flukes. These can be transmitted to humans by a handful of different ways. One is if a human ingests the eggs or larvae found in contaminated food. If you eat meat that's contaminated with worms, if you get bitten by infected insects, or there are certain worms that can penetrate the skin, sometimes through the bottom of the feet or other areas, and enter into the body. Some examples are hookworms that attach to the small intestine and then infect the heart and lungs, or the pork tapeworm, which can be transmitted by eating poorly cooked pork. Remember, we talked about pathogenic and non-pathogenic microorganisms. So we're going to focus a little bit on those pathogenic microorganisms that cause infection and disease in a variety of different ways. A lot of times we see them produce poisons or toxins that as a result cause harm to our body. So something like tetanus. Most of us have had a tetanus vaccine, but we have to get that renewed at least every 10 years earlier if you've had some sort of injury or exposure. Otherwise, that tetanus is going to produce toxins that then cause damage to your central nervous system, which is your brain and spinal cord, areas we do not want toxins or poisons getting into. We may see them cause an allergic reaction, things like runny nose, watery eyes, sneezing, and this can be anything from the flowers outside to the pollen to being allergic to a bee sting. Or we might see them attack and destroy the living cells they invade. So those protozoa that cause malaria are going to get into the body and start attacking those cells that they've gotten into. We're going to see these pathogenic microorganisms or these disease-causing organisms classified as one of 4 ways. We have endogenous, which is an infection or disease that originates within the body. So endo, it starts inside the body. This could be something like a metabolic disorder, congenital abnormalities, a tumor, or an infection that's been caused by a microorganism inside the body. Exogenous is going to be something that starts outside of the body. So a pathogen that then invades the body, something like radiation, chemical agents, trauma, electric shock, something that comes from outside of the body. We have nosocomial infections, which are sometimes known as hospital-acquired infections or HAIs. These are infections that we see someone who's already in a long-term care facility, whether that's a hospital or nursing home, get that is not related to the reason they're there. So if someone is in the hospital for a broken leg and gets MRSA, one of those antibiotic resistant superbugs that might have been transmitted to them by a healthcare worker, now they've got a serious, potentially life threatening infection that came on while they were in the hospital and is not related to the reason they're there. The last thing that we have is opportunistic infections. These are those infections that we see happen when your body's defenses are already weak. So when your immune system is already a little compromised. We tend to not see this in someone who has an intact immune system. So our HIV or AIDS patients, this pneumocystis carinii is a specific type of pneumonia that is only really seen in AIDS patients because their immune system is compromised. Or if someone has a cold and then as a result they get exposed to another infection, whether it's pink eye, strep throat, something like that, that now their immune system's a little bit weaker and more willing to go ahead and let that secondary infection in. So we've talked about the different types of microorganisms. We've talked about the way or how they're classified. Now we need to look at how they're transmitted. So to do this, we're going to look at the chain of infection. The chain of infection itself are the factors that have to exist for that disease to occur and for it to be able to spread from one individual to another. So our primary aspects are going to be our infectious agent, our reservoir, our portal of exit, mode of transmission, portal of entry, and our susceptible host. We're going to break each of those down a little bit further. So our infectious agent is the pathogen. That's the bacteria, the virus, whatever is causing the actual disease. Our reservoir is the area where it lives. So whether it lives in the human body, whether it lives in animals, it lives in the environment, does it live in the dirt outside? Does it stay alive on an object after it's been contaminated with that infectious material? The area where the infection is living. The portal of exit is how it leaves the reservoir. So if it's in the body, is it leaving through urine? Is it leaving through feces, blood, saliva, mucus, a wound? How is it exiting the area it lives? The mode of transmission is going to be the way it spreads from one person to another. So we have direct, which is something like person to person. We have to actually touch the person that has the infection or their body secretion. Our contaminated hands are going to be one of our most common sources, which is why, especially with COVID, we've seen a big stress in hand washing. Or we have indirect contact, where we have seen transmission from a substance, something like food, your clothes, equipment. So you're touching a contaminated object, and then that pathogen is being spread on the skin. You're breathing in the infected air that someone has now coughed or breathed out, or an insect that is carrying that germ has bitten you and now transmitted into your body. Then we have our portal of entry. So how does it get into its new host? Just because I touch someone's blood doesn't mean that I automatically am going to get that disease or a disease. There has to be a way for it to enter my body. So whether that's a break in the skin, through my respiratory tract when I'm breathing in that contaminated air, my digestive tract if I've eaten something infected, my circulatory system, there has to be a way for it to enter the new host. Then we see what actually is a susceptible host. So someone who can contract the disease. Usually, like we talked about with those opportunistic infections, humans can fight off infectious agents. So if you're exposed to the cold, or for instance, I have a young child that's at daycare, she'll come home with germs all the time. My immune system is a little more developed, so I don't necessarily catch all of the same sicknesses that she has, or if I do, they might not be as severe in my adult immune system versus her still developing immune system. Now, our body does have specific defenses that we use to try to fight those things off. Things like the mucus that lines our respiratory, digestive, and reproductive tracts. Those are going to trap those pathogens as they enter your body and try to push them back out. Think about when it's allergy season and your nose is running and all that snot's coming out because all that pollen is getting trapped in those mucous membranes and your body is trying to send it back out. Also in your respiratory tract, we have cilia, which are those little tiny hairs in there that line the respiratory tract and help push those pathogens back out of the respiratory tract. Coughing and sneezing, again, are ways that we push those things back out of the body. Our stomach acid helps kill off things it doesn't want in there. Fever helps to try to kill off some of those germs by heating them up to the point where they no longer live. And then above all else, we have our actual immune system that helps produce those antibodies to combat those different pathogens. Now, like we said, if there's a large number of pathogens or our body defenses are already weak, then we may be more likely to take in that pathogen and actually have it attack our immune system in our body. Here we have just another example of the chain of infection. You can see some examples in the different areas. So infectious agents are things like bacteria, fungi, parasites, and prions. We didn't talk about those. Portal of exit, things like blood, secretions, excretions, and skin. So just some examples of things and the definitions of what falls under each of the different parts of our chain of infection. We're going to talk a little bit about aseptic technique, so ways that we can help break the chain of infection. Asepsis means that we have an absence of that disease-producing microorganism or pathogen, whereas sterile means that we have no organisms, whether they're pathogenic, non-pathogenic, no spores, no viruses. There is nothing on that object. Contaminated pretty much means something's dirty, whether it's an organism, a pathogen. It can refer to an object or an area. Contaminated is not where we want to be. Our aseptic technique is going to help maintain cleanliness and eliminate or prevent contamination. Some ways that we might see aseptic technique are things like hand washing, which we will get all into in our next lecture. Good personal hygiene, using disposable gloves, especially if there's a chance we are going to be contacting body secretions or contaminated objects. Making sure we're properly cleaning our instruments and equipment, and thoroughly cleaning the environment, which is going to be our patient room. We have to look at a lot of different things. For instance, are you wiping down the call bell? Have you wiped down the bed rail? Did the patient touch a tabletop? It might seem silly, but if someone had a cut on their finger and they left a drop of blood somewhere, you want to make sure that that gets wiped up, since there are things that are going to live in blood for a day or two, and we don't want somebody else to come behind them and touch that with a cut on their hand, and now they've transmitted a virus into their body. When we look at different levels of aseptic control, asepsis is going to be our lowest level. So this is where we are preventing or kind of stopping or inhibiting the growth of pathogenic organisms. This is not typically going to be effective against spores and viruses, but it's what we can use on our skin. So hand washing, things like alcohol, betadine, stuff we can use to clean skin is going to fall under asepsis. When we look at the next level, or disinfection, this is where we're killing or destroying some of those pathogenic organisms. It may or may not be effective against those spores and viruses. Remember, those are both very difficult to kill. We don't want to use this on skin, because this is going to be things like bleach or other chemical disinfectants that are going to cause skin damage or skin irritation if we put them on our body. So disinfection we're using on objects, not people. You don't disinfect people. And then our highest level of aseptic control is going to be that sterilization, where we've destroyed all microorganisms, whether they're pathogenic, non-pathogenic. It's going to kill spores, it's going to kill viruses. This can be done as steam under pressure, gas, radiation, chemicals, The autoclave is going to be the most common thing that we see used for sterilization, and we'll talk a little bit about that, I believe. And then the last thing that we're going to touch on just real quick is sharp safety. So a sharp, anything that's sharp, needles, scalpels, razors, we want to work towards using things that are a little bit safer. So safe needles, needleless devices when possible, so that we're not putting ourselves or the patient at risk for a possible stick. You want to remember to never bend or break needles. Never, never, never recap your needle. Never put a top back on a needle. The proper way to dispose of it is make sure we put it in a leak-proof, puncture-resistant sharps container immediately after you use it. Now, the sharps container we'll see an example of in our next unit, but it should be labeled with a red biohazard sticker. We want to make sure that we don't empty or reuse these. Once they're full, you tape them up, someone disposes of them. And then we want to make sure we're following the policy for all disposable of sharps containers based on our facility policy. So I know that was a lot of information, but that's it for our intro. If you have any questions, let me know, and I will see you next time.